Today in the news, the City of Dallas awards more than $600,000 in funds to small businesses, and Texas passes 4,000 deaths from COVID, but Houston sees rates steady, and the Dallas Hospital Capacity Report. Today is July 22nd, 2020, and this is Dallas Weekly News. Hello, I'm your host, Patrick Washington, and this is Dallas Weekly News. The Small Business Continuity Fund program, a partnership between the City of Dallas Office of Economic Development, Dallas Development Fund, and National Development Council, continues to provide financial assistance to Dallas businesses impacted by COVID-19. Since the program's application opened in May 2020, there have been a total of 46 grants approved with an award total of $387,500. The average grant amount is about $8,424, and additionally, 6 loans have been approved totaling $221,000 with an average loan amount of $36,833. The SBCF program was designed to assist low to moderate income micro-enterprise business owners or small businesses with 50 or fewer employees to retain low to moderate income workers within the City of Dallas. Businesses were given the opportunity to apply for a $10,000 maximum grant or a $50,000 maximum loan. There were more than 1,000 businesses qualified for the grant program and nearly 400 businesses qualified for the loan program. Businesses were then ranked by lottery and placed in order to receive funding. To track the data and statistics from the SBCF applications and awards, the Office of Economic Development has created a dashboard. The data from the dashboard can be filtered and searched by council district, award status, demographic information, and zip code. The dashboard is updated weekly and can be viewed on the city's website. Texas surpassed 4,000 deaths in the coronavirus pandemic Monday, but officials in Houston, one of the hardest hit cities in the U.S., say that they are cautiously optimistic about recent trends following weeks of alarming surges at hospitals. Texas reported more than 7,400 confirmed new cases and at least 62 new deaths. The virus continues taking a particularly hard toll along the Texas-Mexico border. Hidalgo County has reported more than 140 deaths over the past week, and the county judge on Monday signed a shelter-at-home order. The new order, which goes into effect Wednesday, sets curfew, limits travel and gatherings, and recommends all non-essential businesses cease any activity that can't be provided at curbside or by takeout. In nearby Starr County, where the Department of Defense has sent one of the 5 teams of Navy doctors to help the only hospital, County Judge Elroy Vera said they were considering creating an ethics committee to discuss rationing hospital resources. But in Houston, officials say they are seeing signs of optimism. Dr. David Percy, Houston's health authority, said during a news conference that the positivity rate of COVID-19 testing has slightly dipped in the recent days, and the number of people requiring hospitalization seems to have tapered off a bit. The positivity rate was 24.5% on Friday, slightly down from the 25.9% earlier this month, Percy said, adding that the positivity rate was still very high. Percy said some of the reasons why hospitalizations might have leveled off recently include hospitals doing a better job of treating patients, and the length of time people are staying at medical facilities is getting shorter. The economic toll of the virus on Texas also sharpened into focus a little more Monday as the state's budget forecast plummeted to the projected $4.6 billion shortfall less than a year after state officials had expected a surplus. Republican Comptroller Glenn Hagar said the forecast remains highly uncertain and depends on whether the outbreak continues to spread in Texas. And now, the City of Dallas's hospital capacity report. This has been Dallas Weekly News. I'm your host, Patrick Washington, and you can find these and more stories on dallasweekly.com. And you can, of course, follow us on social media on Facebook, Twitter, Instagram, and YouTube. And of course, as always, if you can, stay safe, stay home, and we will see you again tomorrow.